Let us see the anatomy of mammary gland. It is the most important structure present in the pectoral region. It is the modified apocrine sweat gland present in the superficial fascia of the pectoral region. It is present in the pectoral region superficially, and it is sitting atop of pectoralis major muscle. This is the pectoralis major muscle. This breast sits atop of this pectoralis major muscle and the axillary tail of Spence. It is the small extension of breast tissue at its superolateral part, superior and laterally. This breast tissue extends known as axillary tail of Spence and pierces deep fascia and extends into axilla, and it passes through foramen of Langer. The place where it pierces is known as foramen of Langer. It pierces the deep fascia and enters into axilla. Axillary tail of Spence. It is the site of high percentage of breast tumor. And shape. It is hemispherically bulged and extent. It extends from vertically from second to sixth ribs and horizontally extends from lateral border of sternum to the mid axillary line. Once again, vertically it extends from second to sixth ribs and horizontally extends from lateral border of sternum to the mid axillary line. Now let us see the relations of the mammary gland. Now let us see the relations from superficial to deep. Superficially it is pectoral fascia is present, which covers the anterior aspect of pectoralis major. Now deeply it contains three muscles. These include pectoralis major, serratus anterior and external oblique. These are the relations. Once again, the relations include superficial to deep, superficially covered by pectoral fascia, superficially covered by pectoral fascia, and deep it consists of three muscles: pectoralis major, serratus anterior and external oblique. Now let us see the structure of mammary gland. Skin, which is the covering of breast. Skin, which is the covering of the breast. Nipple is the conical projection below the center of breast, usually at the level of fourth intercostal space. See, this nipple is present at the level of fourth intercostal space, first, second, third, fourth. So it is present at the level of fourth intercostal space. This nipple is the most sensitive part to tactile stimulation and becomes erect during sexual arousal. It is most richly innervated by sensory nerve endings. It contains smooth muscle fibers which can make nipple stiff and erect or flatten it. Now let us see areola. This is the areola. Areola is the circular area of pigmented skin surrounding the base of nipple. It contains large number of sebaceous glands, particularly at its outer margin. The color of nipple and areola varies with complexion of women, and the sebaceous glands in the areola are enlarged during pregnancy and appears at small nodular elevations known as Montgomery's tubercles. So circular area of pigmented skin surrounding the nipple, color varies with the complexion of women, and Montgomery's tubercles. The sebaceous glands at this outer margin enlarge during pregnancy, so appears as small nodular elevations known as Montgomery's tubercles. And stroma. Stroma consists of connective tissue and fat. Connective tissue. This connective tissue condenses to form fibrous strands or septa called suspensory ligaments of Cooper. This is the fat and the connective tissue. This connective tissue are condensed to form fibrous strands or septa called ligaments of Cooper. Now let us see the parenchyma. This is the parenchyma. Parenchyma consists of 15 to 20 lobes arranged in a radial fashion. Each lobe consists of lobules and lactiferous ducts. This is the lobe. Each lobe consists of lobules and lactiferous duct and lactiferous sinus. Each lobule consists of 2 to 3 acini, 2 to 3 or some number. This acini open into the lactiferous sinus, and this lactiferous sinus opens into lactiferous duct and opens a small pores on the nipple. Now let us see the arterial supply. Superficially drains skin of breast except nipple and areola. Arterial supply. Arterial supply, it is supplied by superior thoracic artery, acromial thoracic artery, lateral thoracic artery, and the lateral branches of posterior intercostal arteries and the internal thoracic artery. From internal thoracic artery, second, third and fourth intercostal spaces, the perforating branches are supplied. Superior thoracic artery, acromial thoracic artery and lateral thoracic artery are the branches of axillary artery. So venous drainage. Venous drainage is by axillary vein, internal thoracic vein and posterior intercostal veins. These veins follow the arteries. In this venous drainage, the superficial veins drain into internal thoracic vein. Superficial veins drain into internal thoracic vein, whereas deep veins drain in all of the three these veins: axillary vein, internal thoracic vein and posterior intercostal vein. Superficial veins drain into internal thoracic vein, and the deep veins drain into axillary vein, internal thoracic vein and posterior intercostal veins. And first, this venous drainage starts from nipple where the veins form venous plexus of Haller, and from there the veins divide into superficial and deep sets. So this superficial veins drain into internal thoracic vein, and the deep set drains into axillary vein, internal thoracic vein and posterior intercostal vein. Now let us see the nerve supply. Nerve supply is mainly somatosensory. It is derived from 2nd to 6th intercostal nerves through their anterior and lateral cutaneous branches. Now let us see the lymphatic drainage. So let us see the lymph nodes draining the breast. First, supraclavicular nodes. Supraclavicular nodes lie above the clavicle. Deltopectoral nodes lie in the deltopectoral groove. An axillary group of lymph nodes. It includes apical group, central, lateral, anterior and posterior groups, and the internal mammary lymph nodes, and also the posterior intercostal lymph nodes. Once again, supraclavicular, deltopectoral, apical, anterior, posterior, central, lateral, posterior intercostal and internal mammary lymph nodes. The lymphatic drainage of the breast. The lymphatic drainage of the breast divided into superficial and deep. Superficially drains skin of breast except nipple and areola. Deep, it drains parenchyma of the breast and the skin of nipple and areola. Now let us see the subareolar plexus of Sapi. A plexus of lymph from the breast drain into the anterior group of axillary lymph nodes. This is the subareolar plexus of Sapi around nipple, and they drain into anterior group of axillary lymph nodes. To understand this lymphatic drainage, first mainly we need to learn this diagram where the breast is divided into upper lateral quadrant, lower lateral quadrant, upper medial quadrant, lower medial quadrant. Lateral quadrants are mainly drained into anterior axillary group of lymph nodes, and the medial quadrants drain into internal mammary lymph nodes. A few lymph vessels from the lower lateral quadrant, they drain into posterior intercostal lymph nodes, and few from the lower medial quadrant, they cross the costal margin and pierce the linea alba and communicate with the subdiaphragmatic and subperitoneal lymph plexus. Here the lower medial, it is communicating with the subperitoneal lymph plexus. The lymph vessels from deep surface of the breast pierce pectoralis major and clavipectoral fascia to drain into the apical group of axillary lymph nodes. Let us see the applied aspects of mammary gland. First includes breast cancer, carcinoma of the breast. This is the most common cancer in female. In about 60% of cases, it occurs in the upper lateral quadrant, and also we have seen that it mostly occurs in the axillary tail of Spence. And the signs and symptoms include presence of a painless hard lump, and breast becomes fixed and immobile, and the retraction of the skin and retraction of nipple, and pudy appearance of skin, and also Kirkenberg's tumor. And also once let us see the deep lymphatics. They pierce the pectoral fascia, pectoralis major muscle, and pierce the clavipectoral fascia, and they drain into apical group of axillary lymph nodes. And now let us see pudy orange. This pudy appearance of skin is due to the hair follicle pits that appear to be retracted beneath the level of skin due to the obstruction of superficial lymphatics. And this breast becomes fixed and immobile. First, presence of a painless hard lump. Next, breast becomes fixed and immobile because the suspensory ligaments are infiltrated because of cancerous cells. Now, retraction of the skin. It's also the same reason. Infiltration of suspensory ligament by cancer cells. Next, retraction of nipple due to infiltration and fibrosis of lactiferous duct. So this is the anatomy of mammary gland. Thank you.